Are you suffering from gastrointestinal discomfort, gas, bloating, constipation, or diarrhea? Or maybe you've been diagnosed with a GI disorder, such as irritable bowel syndrome. If so, you're not alone. According to the American College of Gastroenterology, IBS is the most common disease diagnosed by gastroenterologists and one of the most common disorders seen by primary care physicians. If you're living with gastrointestinal distress, you know what a burden it can be on your physical health and your emotional well-being. It can get in the way of your everyday life, at work, school, or important events. It can be a struggle, not understanding where, when, and especially why your symptoms appear. Everyone's gut is different, and there are a multitude of factors contributing to your body's flare-ups. One of the biggest contributors is the food we eat. Navigating which foods to eat and which foods to avoid can feel impossible, but it doesn't have to be that way. Research has shown that individuals with IBS and other GI conditions can experience improvement in their symptoms through implementation of the low Fodmaps diet. You might be thinking, Fodmap? What is that? Well, Fodmap is simply an acronym for fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. They are specific foods that cause malabsorption, water retention, fermentation, and more simply put, a bad reaction in your small intestine. Therefore, foods that are considered high in FODMAPs can play a major role in your uncomfortable GI symptoms. So, which foods are considered high in FODMAPs? Here are just a few examples of high FODMAPs in each category. Garlic, onions, shallots, beans, and foods that are high in wheat and grain contain oligosaccharides. Apples, watermelon, asparagus, Brussels sprouts, and foods that contain artificial sweeteners are made up of monosaccharides and polyols. Soft cheeses, cow's milk, and creams contain disaccharides. Alternatively, foods that are low FODMAP include lettuce, kale, spinach, tomato, bell peppers, eggplant, and sweet potato, to name a few vegetables. Strawberries, oranges, pineapple, and blueberries are all low FODMAP fruits. Butter, eggs, almonds, walnuts, pecans, and minimally processed meat protein are all low in FODMAPs. Even hard cheeses, such as cheddar, Parmesan, and Swiss, along with cow's milk substitutes, such as oat milk or almond milk, are considered to be low FODMAP. If you're already thinking this sounds complicated, don't fret. Keep listening to learn how we will simplify all of this with a daily action plan just for you. You might be wondering, how does this low FODMAP protocol work? It works in 3 phases. In phase 1, you eliminate all high FODMAP foods from your diet for 3 weeks. The goal of this elimination phase is to get your body to a place where you're experiencing little to no food-related symptoms. During this time, you'll work to evaluate what other factors could be contributing to your symptoms, such as stress, lack of sleep, dehydration, etc. This phase 1 elimination is only temporary, and it's important to note, the low FODMAP diet is not a permanent protocol. There is no need to cut out all high FODMAP foods forever. Instead, the ultimate goal is for you to discover which foods you should and shouldn't incorporate into an everyday diet, because everyone reacts differently to different FODMAPs. And that's where phase 2 comes into play. Once you've eliminated all foods that could potentially aggravate your symptoms, you will now be able to test exactly which foods cause your problems. So in phase 2, you'll reintroduce one FODMAP food from each category in order to test your level of tolerance for those foods over a period of 3 days. For example, if you were to test your sensitivity to oligosaccharides, you would test out a 1/8 of an onion on day 1, then a 1/4 of an onion on the following day, and finally 1/2 of an onion on the 3rd day. Following these 3 test days, you'll take a 3-day break and then resume with more tests. Following these tests, you'll have a greater understanding of which FODMAPs work for you and which foods cause those symptoms to flare. Once you've done that, you'll be ready for phase 3. Phase 3 is the maintenance phase, also known as the rest of your life. You'll use the tools that you've learned from the protocol in order to tailor a diet that is right for you. If you're thinking, this sounds like an amazing plan, but I don't know where to begin, don't worry. That's where your online low Fodmap program comes in. Not only will you receive breakfast, lunch, and dinner low Fodmap meal suggestions, but you'll have video resources, everyday to-dos, and motivation to keep you on track. The best part? Your program comes with access to a complete lifestyle web portal and app for your phone. It's like having access to all of us on your care team 24/7. We built an amazing web platform that emails your plan every day of the program. You can log into your account, keep a journal, track your progress, and follow your program materials anytime from your computer or on the app for iPhone or Android. Here are some quick highlights of what you can do with our portal and app. Access all of your program materials, recipes, tips, documents, and more anytime you'd like. Track your foods to keep tabs on which foods might be aggravating your symptoms and which ones really worked for you. Search 800,000 foods, scan a barcode, or even just snap a picture of what you ate. It's easier than ever. Keep a journal to record your thoughts, reactions, and progress as often as you'd like. Track your activities, including exercise, sleep, water intake, and more. You track it in your portal, and we'll be in the loop about your progress automatically. Send private messages to anyone on our team from right inside your app or the web portal. You deserve to take control of your GI symptoms. If you're not already signed up for the low FODMAPs diet, be sure to talk with one of our staff now. If you are, be sure to log into your new portal account, download the app, and get started on the new you.